Deciding the birth choice. There are plenty of options available for pregnant women and their families when it comes to birth choices. Whether you wish to use a birth pool during labor, have a home birth, try a lotus birth, or a vaginal birth after caesarean, this video will inform you all about the different birth choices. Lotus birth. Lotus birth is the practice of leaving the umbilical cord uncut after childbirth, so that the baby is left attached to the placenta until the cord naturally separates at the umbilicus, usually a few days after birth. There has been research in the past few years which found that when doctors delay clamping the cord, the baby receives higher levels of iron, which prevents anemia. This prolonged contact can be seen as a time of transition, allowing the baby to slowly and gently let go of his or her attachment to the mother's body. Birthing ball. Exercising on a birthing ball in pregnancy can help to reduce any back pain you are experiencing and make it easier for you to move around. It can also help ease labor pain, reduce the pain of contractions, especially if you use it for a couple of months before you give birth, decrease anxiety, and shorten the first stage of labor. However, if you feel dizzy or ill, don't use your ball. Using a birthing ball can also help you adopt different upright positions, which can help you to labor effectively. It may even shorten your labor by an hour or so. Ways to use your birth ball during labor include sitting astride the ball and rocking your pelvis from side to side or back and forth. Getting into a hands and knees position by hugging your birthing ball and lifting your bottom up from a kneeling position. You can then rock your pelvis from side to side. These positions also give your birth partner plenty of room to support you, massage you, or apply pressure to your lower back during contractions. During the pushing stage, you'll want to avoid sitting, so use the leaning or hands and knees positions. They will take the pressure off your bottom and give your baby lots of room to descend with each contraction and to be born. Stand and deliver. Upright birth. Changing positions and moving about during labor and birth is as ancient as birth itself. Ironically, it is only in the last couple of 100 years that women have been giving birth on their backs in bed. The first record of a woman lying down to give birth was in the 17th century, when the mistress of the French king, Louis XIV, lay down so he could watch the birth from behind a curtain. Next came the invention of the forceps in the middle of the 17th century, and before long, birth in bed, rather than upright, in the traditionally used birth chair, became the norm. Sadly, this was not done with women's best interests in mind. After several decades of research, we are trying to reverse this trend. Try lots of different positions until you find the best position for you. Keep active for as long as you can. Try and stay off the bed. Have support people who are prepared to help you, support you, and make you comfortable. If you are tired and need to rest, try to choose a position that keeps you off your back and as upright as possible. Avoid unnecessary interventions, like epidurals if possible. Many doctors and some midwives feel nervous about helping women give birth, so make your wishes clear beforehand. Your birthing position is your right. Rebozo birthing. The rebozo is a traditional Mexican shawl that is long enough to wrap around a woman's body. The rebozo is a multifunction tool for labor, used to assist the mother into various positions and for relaxation. If you do not own a rebozo, you can substitute a large scarf, sheet, or piece of fabric. Mexican midwives have used Rebozo abdominal massage to help move babies before labor begins. The basic concept is to produce movement in the direction you want the baby to turn. However, because the midwife positions herself to support the mother's pelvis in the rebozo, like a hammock, the mother is able to become more fully relaxed, improving the chances the baby will turn. The pelvic support can be provided with the mother lying on her back with knees up, or in a hands and knees position. The basic movement is more like a rhythmic step than a swing. You are not swinging the mother's hips from side to side. Instead, you are slightly lifting one end of the rebozo, then the other, back and forth, rather quickly. This basic movement relaxes the mother. When she is relaxed, you will give a strong tug on only one end of the rebozo. This causes a jerk to the baby, which encourages movement in the desired direction. For this type of massage, jerk the end of the rebozo on the side you want the baby rotate toward. Active birth. Slow dances. Childbirth professionals encourage the practice of belly dance for pregnancy. The music is hypnotic and can take you to an altogether different place, so you can be taken away from the anxious state of mind that you may find yourself in. Belly dancing is designed perfectly to help women's bodies be in balance. When done during pregnancy or labor, it helps the baby move into a good position, ready for birth. The muscles of the uterus move the baby in a clockwise corkscrew fashion. Belly dance moves enhance this natural action. Hypnobirthing. Hypnosis is a naturally induced state of relaxed concentration, in which we communicate suggestions to our subconscious mind. This part of our mind influences what we think, how we feel, and the choices we make. It can actually control pain. There is no magic to achieving success with self-hypnosis. Almost anyone who chooses to can reach deep relaxation and redirected focus. When having your baby with hypnobirthing, what you experience is similar to the daydreaming or focusing that occurs when engrossed in a book or staring at a fire. You will be conversant and in good spirits, totally relaxed, but fully in control. You will be aware of your body's contractions, but will not be able to determine the extent to which you feel the surge. You will experience your birthing in calm relaxation, without the fear and tension that cause pain. Your body's natural anesthesia will replace the stress hormones that create pain, and when it's time for baby to be born, you will be fully awake and involved. The hypnobirthing advantages are: eliminates the first tension pain syndrome before, during, and after birthing. Eliminates or greatly reduces the need for chemical painkillers, and shortens the first stage of labor by several hours. Eliminates fatigue during labor, enabling you to be fresh and awake, with energy for birthing. Eliminates risk of hyperventilation from shallow breathing methods, and allows a more rapid postnatal recovery. Creates a more integral role for the birthing companion.